Let's talk health. If you think hypertension or high blood pressure develops only in old folks, you may need to have a rethink, because health experts say rising cases of cardiovascular diseases occur in adolescents and teenagers. We have more in our next report.
Urban centers across Nigeria are facing a major health issue: hypertension, also known as high blood pressure. This silent killer is a cloaked threat affecting many lives. In recent years, this condition has become a leading health concern in Nigeria, highlighting the need for greater awareness and action. Few people openly share their struggles with high blood pressure or hypertension.
Where they involved in all these projects for these different areas, that they always did.
But Esther Nwankwo, a radio presenter, courageously speaks about her own journey. In April 2022, Esther visited a local pharmacy to pick up pain relievers for frequent headaches. Following the pharmacist's advice, she took a blood pressure test only to discover her reading was a staggering 179/115. A wake-up call that changed everything from lifestyle to diet.
High blood pressure was something that I just never expected, that I would have. For me, it was quite scary, because sometimes I would intentionally choose that, okay, I've taken this medication for a while, the amlodipines and the vasoprene or whatever. I've taken it, so this should make it go away. And then I check my BP, I'm fine. And then I check a couple of weeks later, after not checking for like maybe over a month, and then I see that it's going high again. So I'm like, okay, I think I actually need to manage this. You guys are very young.
Now, in every space she finds herself, she advocates for the need to get regular checks at a health facility.
Having good support system can save you a great deal. It can help you because you can get high BP and start overthinking and over-imagining, and it could, in a way, make it worse.
Health experts have identified cardiovascular diseases as likely causes of sudden deaths in Nigeria. They are of the opinion that these deaths may have been prevented if these patients went for regular medical checks.
In an urban center like Lagos, just a few persons I spoke with go on regular medical checks. Even those working within a facility assume all is well with their bodies.
Not really. Why? Well, I don't really have time, that's why. But if I do feel somehow, I rush down there to check up.
Now you go to hospital for medical checkup, they will not say something. Is it that they will say your BP is high, you have low sugar, you have your sugar is too much. And for me, I don't want to hear anything.
I'm not used to it, so like I always feel like I don't need it, nothing's wrong with me, so I just ignore it, something like that.
But you work in the hospital?
Yeah, I work in the hospital.
For Dr. Olujimi Shodipo, a general medicine consultant at the Lagos State Teaching Hospital, sudden deaths can occur from a range of cardiovascular complications like hypertension-related ones and heart failure.
Major drivers of cardiovascular problems is hypertension, which is high blood pressure. And we've called it a silent killer because there's no sign, there's no symptom. A lot of people believe they should have headaches. A lot of people believe they should have chest pain before they know, oh, I have a high blood pressure. And even people that are hypertensive say, oh, sometimes I skip my drugs, but when I have headache, I take my drugs. Unfortunately, that's not the case. A lot of us are overweight, obese. That's one cardiovascular problem. A lot of people have high blood glucose. They don't know about it. Again, asymptomatic. And there's a feeling that some of these diseases could only occur at certain ages. And once you're past that certain age, or once you're not up to that age, then you're free from it. So all this is driving a very dangerous cocktail and is increasing, the risk of people having sudden death.
It says individuals need to pay more attention to their habits if they must live a pain-free life.
These diseases are occurring, and they're occurring at a younger age. So the first thing is we need to also look at things as simple as family history. Is there anybody in the family that's had sudden death? We need to start screening everybody from the age of 18. Even when they're asymptomatic, look at their blood pressure. Try and look at other things like, for example, their glucose levels. Now that we're having a lot of people being obese and on the big side, we also need to screen, because that's also one of the risk factors for hypertension, and also for diabetes.
Surviving patients of high blood pressure, like Esther and health experts, advising Nigerians to seek medical advice, modify their lifestyle, and they're also asking government to introduce health support schemes in this regard. Sarah Ayiku, TVC News, Lagos.